Good evening and a warm welcome to all the viewers. Along with Dr. Mangesh Bhalerao, Head of Medical Services, I am Avinash Singh. And on behalf of RPG Life Sciences, I welcome all for today's webinar on general awareness for cancer. To talk more on this, we have with us Dr. Sushant Mittal, our respected guest speaker for today. Welcome, sir, and thank you for joining us. To give a brief introduction about Dr. Mittal, Dr. Sushant Mittal is one of the most vibrant and enthusiastic oncologists in the country, knowledgeable and confident, and his research in the field of Hodgkin lymphoma has greatly improved the patient outcome. Dr. Mittal is MD/DM Oncology and currently associated with Action Center Hospital, New Delhi as a consultant medical oncologist. While holding many responsible positions and gaining extensive experience in working with cancer patients, he has also spent considerable time in teaching, training, and upskilling postgraduate students and nurses. Dr. Mittal has numerous national and international publications to his credit as well. Moreover, he is a member of several professional associations and organizations like ISMO, ICON, ESCO, API, and many more, and has received numerous awards and recognition. So without any further ado, I welcome Dr. Mittal and would request him to please carry forward the session. Thank you, sir. Over to you.
Thank you so much for these kind words. And thank you all panelists and attendees for joining this session. I'll be discussing about general awareness on cancer as in my practice, I've seen a lot of myths and false information is always there surrounding the treatment of oncology, whether regarding biopsy or treatment or side effects or newer technologies. So next slide, please. So, excuse me. So the outline would be what is cancer, important dates related to cancer, prevalence and myths, basic terminologies, symptoms, risk factors, types, stages, treatment, famous references, and self-risk calculator. Next slide. So Cancer Awareness Days in January, it is the cervical. I'm sorry. So January is Cervical Cancer Awareness Month. Cervical cancer is one of the most common cancers in women, and it is preventable by a routine pap smear. Then February is National Cancer Prevention Month. Amongst them, the gallbladder and bile duct cancer awareness is there. The Ganges belt, wherever the Ganga river is flowing, has been shown to have more commonly gallbladder cancer, probably because the hard water which the people over there take leads to formation of stones and causing gallbladder cancer. Other are World Cancer Day, National Donor Day, and Rare Disease Days are also there in the month of February. Along with that, in March, we have Colorectal Cancer Month, then International Women's Day, triple negative breast cancer, kidney cancer, myeloma cancer, and anal cancer awareness. Amongst this, colorectal cancer is now a common cancer which is rising up the ladder, probably because of the sedentary lifestyle and red meat and non-fiber diet, which is leading to more cases of colorectal cancer. In April, again, we have esophageal cancer awareness and minority cancer awareness, such as rare cancers which are there. Then head and neck cancer awareness week. We know India is a country where a lot of tobacco is taken in form of gutka, pan, or kheni, or smoking. So head and neck cancer overall is the most common cancer among men and women. In May, we have, and again, bladder cancer, brain tumor, cancer research month is there. Clinical trial awareness, melanoma, which is not so common in India, but now since last 5 years, I've seen it is getting little common, not so rare, but it is still there. In June, we have Cancer Survivors Month. So every year we invite our patients who have lived long and who have won against the battle of cancer, and we invite them to share their experiences. Next slide. In July, we have Sarcoma and Bone Cancer Month. August is World Cancer Day. We have a national conference and international conference always dedicated to lung cancer. A lot of developments have taken immunotherapy, chemotherapy, targeted therapies in lung cancer. In September, a lot of cancer are there: childhood cancer, uterine, gynecological, ovarian, prostate. So all these cancers are there. October is Breast Cancer Awareness Month. You must be aware that a lot of pink marathons are there. A lot of celebrities in the month of October all over in Mumbai, Maharashtra, Delhi, Chandigarh, all parts of India. They have pink marathon, which is the pink ribbon, which is there, which is the sign of breast cancer, is for their awareness, because a lot of women do not come up with a breast lump. They are shy, they have stigma, so they do not come. So to raise those awareness, patients or people do these such kind of awareness months. In November, we have lung cancer awareness again, and then neuroendocrine, pancreatic cancer, and stomach cancer awareness. Next slide. So obviously this question, are you scared about cancer? Yes, everyone is scared about cancer. I see daily patients who I declare that they have cancers and their life just goes upside down. But the best part is that now newer technologies, newer researches are there which help to cure these patients and help them to lead a good and normal life. Next slide. So myth is cancer means death, cancer means costly treatment, all cancers are same. So all these are myths. Next slide. Again, even after treatment, the cancer comes again. Cancer is contagious, cancer treatment is painful. So all these are myths. Previous slide, please. So cancer means death? No, it's not so. Usually what happens that people who are cured from cancer, they do not tell the society or the people that they had cancer because of the stigma attached. We only get to know people who have died from the cancer or who have not survived. That's why majority of the people or the general population have this, that cancer means death. No, there are so many survivors of the cancer, but we do not get to know because people they don't tell that they had such a disease. So when you see follow-up patients, then you realize, yes, people do survive from cancer. Cancer means costly treatment? No, initially yes, but nowadays because of the DPCU, because of the government schemes, insurance policies, and many of the drug companies have now given patient assistance programs, the cancer treatment has become affordable. And obviously in private hospital it is not as cheap as in government hospital. That can never happen. So if people compare that government mein itna kam hai or private mein itna zyada, that will always remain there, but you do get services in private hospital. So but the drug cost and all those things have significantly reduced. When I was resident at AIMS in 2009, and that time and this time, the treatment of cancer has reduced significantly. All cancers are same? No, we have about 14,000 different types of cancer, and all of them do not say have the same prognosis. Two gallbladder cancers are not same, two breast cancers are not same. So how can all cancers be same? So this is a big myth that all cancers are same and all of them are given same chemotherapy. No, different cancers behave differently. Same cancers can behave differently, and different cancers have different chemotherapies. Next slide. Even after treatment, the cancer comes again. Yes, that's a possibility. But if you take a correct treatment, the chances are less. As the science is progressing, we have more and more maintenance chemotherapies, maintenance targeted therapy. Just like we give some medicines for blood pressure and sugar, you have to eat the medicines and the disease remains under control. Similarly, we have maintenance therapies for for different cancers, with which the patient becomes the disease doesn't come back and remains under control. Another myth, cancer is contagious. Many a times people isolate the cancer patient, ये छुआछूत की बीमारी है, same plate में खाने से फैलेगा, same bed पे सोने से फैलेगा. ऐसा नहीं है. Cancer is non-contagious. Do not separate those patients. Do not, they are already depressed, they are already pareshan, and if we tell them that we cannot touch you, we cannot talk to you, or a truth, so it really takes a toll on their life and health. So cancer is non-contagious. Cancer treatment is painful? No. The treatment is not painful. The cancer can cause pain. The cancer, if goes to the bone, then it can cause pain. Cancer goes to the brain, then it can cause pain. But the cancer is treatment is not painful. Giving chemotherapy or giving tablets or giving immunotherapies is not painful anytime. But when patients come in later stage and then they have pain, they receive chemotherapy, the pain increases because the treatment the tumor cells start dying. So the cancer treatment is not painful. The cancer itself, in depending on the location where it is present, causes pain. Next slide. So all these are just myths. We need to know the facts as I told you. Next slide. Now, 5-year survival. Whenever patients ask you what are the chances, or relatives ask you what are the chances that we'll survive for a long time, long year. So what we tell them that the 5-year chances, this is what we tell them, that in stage 1, 5-year survival is about 80 to 90%. In stage 2, it is 50 to 60%. In stage 3, it is 25 to 30%, and in stage 4, it is 15%. This is broadly we have defined. This is not necessarily same for all cancers. We have different survival rates for different cancers, but this is broadly easier to remember and easier to explain, that lower the stage, higher are the chances that you'll remain cured for 5 years. Next slide. So are you aware of World Health Organization? We all are aware, especially after COVID. We know what World Health Organization is there. It's an organization in which all countries participate. They share their programs of how to take care of the health, and they have told that at least 1/3 of the cancer cases are preventable. 1/3, that is about 33% of the cancers are preventable. And I'll just tell you how. Next slide. So Indian scenario, as I told you, lung cancer is the most common cancer. Then the stomach cancer is most common in southern part of India, probably because of their spicy food, that is rasam and sambar, or hot coffee, filter coffee, what they take in absolutely in hot state when they take. But then the esophagus gradually the lining of the esophagus and the stomach gets changed. So that's why it may be more common over there. In rural India, oral cavity and hypopharyngeal cancers are more common, probably because people over there just put a quid of tobacco in their mouth and they keep working in the farms for longer hours so that they are not hungry, and they just take that tobacco. Next slide. In females in urban India, breast cancer is most common than cervical, and in rural area, cervical cancer is more common. This cervical cancer is more common in rural India because of the poor hygiene, not using proper hygienic uh, sanitary pads, not cleaning themselves properly. So the HPV virus, human papilloma virus, is more common in those areas, and then it causes such kind of cancers. Next slide. In general, nasopharyngeal cancers are more common in northeastern part of India. Gallbladder, as I told you, are more common in Punjab to West Bengal. Thyroid cancers are more common in southern tip and in the states of Goa. Next slide. So what is a cancer? So we know that every day new cells are reproduced by the body. Cells die, cells reproduce. So what happens is, suppose the body today requires 4,000 cells in the body. So it will produce 4,000 new cells and it will stop. We have these signaling pathways which tell, okay, now you stop, we had 4,000 cells requirement is fulfilled. But what happens if these targeted cells or these signaling pathways get disturbed? They do not stop at 4,000 cells. They produce 6,000, 8,000, 11,000, 20,000 cells or 1 lakh cells. So whatever these unnecessary cells are produced, which are not required by the body, are they form cancers. So it can happen either in breast, the unnecessary cells which are present in the breast tissue can cause breast cancer. It can happen in gallbladder, it can happen in brain, it can happen in blood. So wherever these unnecessary cells which keep growing in the body are there, it forms a cancer. Next slide. So this is the normal cell division. The cells 1 is to 2, 2 into 4, and then is damage appears in the cell, and these cells undergo apoptosis, or body kills those cells. These are damaged cells and we do not require such cells. So this is known as apoptosis. However, because if the cells are not going under apoptosis, so these damaged cells keep growing and then they become cancerous for the body. Next slide. So cancer cells continue to divide without control and form new abnormal cells. Cancer cells can also invade into other tissues so that normal cells cannot do. So the breast cells normally does not enter the bone or brain, but the malignant cancerous cells of the breast can go into the brain, can go into the lung, can go into the bones. So that's what it means, that the normal cells do not invade into other normal organ, but the cancerous cells can do that. Next slide. So cancer nomenclature, cancer may spread, but it is always named from the place where it starts. So lung, if it starts from lung, it becomes lung cancer. But if it goes from the intestines to lungs, then the primary cancer is intestinal cancer, as shown in the diagram. It is the primary cancer is from the intestine, which has gone to the liver, gone to the lung. So we may do the biopsy from lung, but the special test when we do tells us that the primary origin of the cells is from the colon. So this is how this cancer cell spreads. The primary cancer cells is there. It spreads from the blood and goes to the metastatic tissue. So for example, the cancer that starts in the breast is called breast cancer. If it is not spread, it is known as localized breast cancer. If it is spread, it is known as metastasis. Next slide, please. Now, hallmarks of cancer: self-sufficiency in growth signals. They evade apoptosis, that is, they do not undergo death. Limitless reproductive potential, as I told you, 4,000, 8,000, 8,000, 11,000, 11,000, 20,000. So they keep growing. Genomic instability, these cells have abnormal DNAs which is not required by the body, and then also they keep growing. Tissue invasion and metastasis, as I told you, the breast cancer when it spreads can go into the brain, lung, or bone. Sustained angiogenesis. Angiogenesis means newer blood vessels. So obviously these cancer cells require nutrition for growth. So for when they go from breast to lung, so then they develop new blood vessels for them so that they can keep growing and they can get the supply of nutrition from these newer blood vessels. Next slide. So when the cancer cells start dividing, they undergo first mutation, second mutation, fourth mutation, and then they undergo uncontrolled growth. They just keep growing, which is out of proportionate to what is required by the body. Next slide. Microscopic appearance of the cells. So if you see normal cells which are pink in color, these are well-defined circular cells. But if you see the cancerous cells which are green in color, they have no shape. They can be in any shape. Shapeless forms are there. They do not have any organized structure. As you can see, this is a disorganized pattern. The nuclei inside is largely variably shaped. The cytoplasm is variably shaped. There's variation in the size and cell. The normal features cannot be seen. There are no tumor boundaries. There are irregular tumor boundaries. Next slide. So root cause of cancer, any change in the DNA. As I told you, the signaling pathways are damaged. So these signaling pathways are in form of DNA. So these DNA, when damaged, are not in cancer cells, the damaged DNA is not repaired, but the cell doesn't die like it should. So instead of that, the cells goes on making new cells that body doesn't need. These new cells have the same damaged DNA as the first cell does. Next slide. So tumor is any abnormal lump or collection of cells. Tumors can either be benign or malignant. Some cancers like leukemia rarely form tumors. So you must have seen many people have some चर्बी की गांठ या फैट की गांठ उसको बोलते हैं लाइपोमा. These are tumors. These are not cancerous collection, but abnormal collection of the abnormal collection of the cholesterol or the fat cells in the body. But those are not cancerous. So those are benign tumors. Next slide. So what are the characteristic difference between benign and malignant. Benign is non-cancerous, malignant is cancerous. So benign are usually well differentiated, whereas malignant are poorly differentiated. The rate of growth is slow for benign, it is rapid for malignant. Local invasion, it is localized and covered by capsule, these benign, but malignant spread along the structures. There are no metastases. In malignant, there are metastases present. Next slide. Malignant tumor classification, carcinomas. Most of the cancers are in form of carcinomas. They start in epithelium, which is covering of the organs and the body, such as skin. Sarcomas, these from the connective tissue of the body, such as muscle, bone, and fatty. These are about 6% of the cancers. Next slide. And how does the cancer spread? They can spread either through the lymph nodes or to the blood vessels. The process of spreading of the cancer is known as metastasis, and direct spread is invade into and destroy the normal tissue surrounding it. So if suppose the colon cancer, as is shown in the diagram, this colon cancer goes into the brain, it either goes to the blood or lymph nodes, but this colon cancer grows locally, it invades the local tissue and causes pain. So that is the direct spread. Next slide. Lymphatic spread, tiny clumps of cells break from the primary tumors and enter the nearby lymph vessels. And in bloodstream, tiny clumps of cells break from the primary cancer, but and they enter the surrounding blood vessels and are carried to different other parts of the body. Next slide. So primary cancer is where the cancers originally started, whereas cancer cells break off from the primary site and spread to the other parts of the body. They are called as secondary cancers or metastasis. No matter where a cancer may spread, it is always named based on the place where it started. For instance, colon cancer that spread to the liver is known as metastatic colon cancer and not liver cancer. Cancers are treated according to from where they started. Next slide. So why cancer diagnosis is difficult? Carcinogenesis, that is the transformation from normal cells to cancer cells, takes many years. More than 10 years can go between the exposure to a carcinogen and diagnosis of cancer. The long period of time between the first cellular abnormality and the clinical recognition that cancer is present often makes it difficult for pinpointing the cause of cancer. Next slide. So causes of cancer can be genetics. It runs in the family from father to son and then to grandson, or from mother to daughter to mosi, bua. Or it can be environmental factors such as smoking, pollution, adulterated food, adulterated milk, and viruses such as hepatitis C, hepatitis B, HPV, various other viruses. Next slide. So development of cancers, as I told you, from normal cells, DNA damage occurs, then the failure of DNA to repair, and then they start proliferating and progressing. Next slide. So risk factors for cancer: as you get old, more are the chances that your DNA will get damaged. Chronic alcoholic use, exposure to cancer causing substances such as radon and second-hand smoke, chronic inflammation such as ulcerative colitis and Crohn's disease, use of hormone therapy such as menopausal hormone therapy or OCPs, HIV, HPV, hepatitis B, C are other factors. Having a body mass index that is more than 25, if you're morbidly obese, then such patients or such people can also have cancers. Ultraviolet exposure to sun and tobacco use. Next slide. Stages of cancer. It means how far the disease has progressed, how far the disease has gone. There are two types. Stages of cancer. The most commonly used is TNM stage, and then it is classified into stage 1, 2, or 3, and 4. Next slide. Stage 2 is carcinoma in situ. Stage 1, it is localized to the body and confined to the cancer of origin. Stage 2, it has spread to the nearby tissue, but not beyond the original location. Stage 3, spread to the lymph nodes, and stage 4 is when it has spread to other parts of the body and is often inoperable. Next slide. TNM staging, we have to decide various whether it has invaded the mucosa, submucosa, muscularis propria. So all these things are defined, and then accordingly we decide which T stage is it in. And in lymph nodes, it is either stage 1 lymph nodes or 2 lymph nodes or 4 lymph nodes accordingly. And M is metastasis, whether there are distant mets present or not present. Next slide. The grade of cancer, reference to the appearance of tumor under the microscope. Low grade cancers, intermediate cancer, and high grade cancers. Next slide. Treatment of cancer. It can be either by surgery, radiation, or chemotherapy. Surgical therapy is total removal of the cancer. Radiotherapy, the disease are irradiated, special X-rays are given to that area. And chemotherapy is by treating, by giving medication, that is either intravenous or oral. Next slide. Surgery is done for many reasons. Prophylactic surgeries, then diagnostic surgeries such as biopsies are done, curative surgery, when we have to remove whole of the organ, staging surgery to know where all the disease has spread, debulking surgery to reduce from 10 grams to 1 gram, palliative surgery to give relief to the patient, supportive surgeries, and restorative surgeries. Next slide. Radiation kills cancer cells by damaging their DNA by charged particles. Radiation use are high energy radiation, and X-rays or gamma rays, charged particles are used for the treatment of cancer cells. Next slide. Radiation can be external beam radiotherapy as shown in this diagram. Patient are lie down in the machine and the X-ray these radiations are given. And internal radiation, a catheter is placed into the body through which radioactive material gives the radiation to the defined organ. Next slide. Chemotherapy, these are powerful drugs which kill the cancer cells or control their growth or relieve their pain symptoms. It involves administration of single drug or combination of 2 or more drugs depending on the type of disease and the need for the patient. Chemotherapy is given through blood, which travels all through the body and takes care of the cancer cells. Next slide. Goal is to shrink the tumor before surgery or before radiation. Destroy the microscopic cancer cells that may remain after the surgery or radiation, which are not visible by the naked eyes. Destroy cancer cells that have come back or spread to other parts of the body. Next slide. Control the tumor growth when a cure is not possible, and ease the cancer symptoms such as shrinking the tumor that causes pain or pressure. Next slide. Famous celebrities such as Sonali Bendre, she was diagnosed with ovarian cancer. She has survived. Lance Armstrong and Matthew Wade and our own Yuvraj Singh have suffered from testicular cancers, and they are cancer survivors. They have fought the cancers and taken the treatment at the correct time, and they are now living a normal, healthy life. Next slide. Angelina Jolie, she had a preventive double mastectomy. She had a gene which was present in her body, from her mother, which is known as BRCA gene, and she was very much prone for having breast cancer. So she underwent preventive double mastectomy for her survival. Hugh Jackman, who was famous for Wolverine in X-Men, had undergone a skin cancer. Sanjay Dutt, because of chronic smoking, developed lung cancer. Next slide. Then we have Manisha Koirala from ovarian cancer. Maggie Smith had breast cancer. She's a famous character from Harry Potter. Robert De Niro had prostate cancer, and he's surviving well now. Next slide. We had few celebrities who did not survive because of the cancer. We have this Chadwick Boseman who had an aggressive colon cancer. Our own Irfan Khan, who had an aggressive brain cancer, and Rishi Kapoor, who had blood cancer. So remember, complete body checkup is the solution. I keep telling my patients and my relatives and friends to have an executive health checkup once a year. All hospitals have nowadays executive health checkup costing about 6,500 to 7,500. It has all the blood test, ultrasound, chest X-ray, ECG. So at least you know what is there in the body. Although it is not that 100% it is preventive, but at least you know what can be taken care of. If you have deficiency of vitamin D, which is the common cause for cancers or lymphomas, or vitamin B12, you can replace them. If you have any growth in the gallbladder or in breast, when you do a mammogram, you will get to know before it's too late, and we can get these surgeries done or treatment done before time. Next slide. So having an early detection plan, as I told you, adults should have a regular test. They are called as screening programs. Talk to your medical provider. They will guide you. If cancer is found early, it can be treated. Survival also tends to be longer for early cancer detection. Next slide. So cancer risk calculator, you can go through this link, and you can find out how old are you, what is your family history, what are your blood reports. If you enter all this data, you will get to know whether you are prone to cancer or not. Next slide. Thank you so much for your patient hearing. The house is open for the discussion if anybody wants to ask any questions.
Thank you, Mittal sir, for this wonderful presentation and explaining everything about cancer. And I'm sure this would be helpful for our viewers who have joined us. Now, we would request if anyone have any questions, they can type it in the Q&A box below. Mittal sir would be happy to answer them. You can type the questions in Q&A box. We have one question from Gaurav Sharma. Use of plastic also causes cancer, like in tea cup. Is it true or not?
So yes. So as I was saying, these plastic cups which are given on all those potteries and all those chai ke thelas, those plastic cups are very thin quality, poor quality plastic cups. And when you put such a high temperature tea in it, so little bit of plastic gets eroded and gets into the tea. And those plastics are not good for the health if taken over a chronic period. So it is better to use those thermocol cups or the metal cups, which are better.
Uh, we have few questions in our WhatsApp box too, sir. I'll read it for you. Uh, what are the most common diagnostic tests or procedures which a cancer patient would need?
Which a cancer patient should undergo, a normal patient for detection.
For cancer patient means if he's is having a cancer, and further if anything is to be known, what are the
Yes.
common tests?
So usually the blood test, which is complete hemogram, LFT, KFT, ultrasound abdomen, and chest X-rays are usually done once a year. We do sometimes PET scan to diagnose early cancer if the recurrence is there or not. So these blood tests and X-rays and ultrasound can help us for early diagnosis.
uh, Second question is it is related to COVID situation. It is about someone is asking, are cancer patients more prone to COVID complications?
Yes, they are more prone to COVID complications because their immunity is already low. And if suppose a lung cancer patient has COVID, so his lungs are already damaged because of the cancer and smoking. And if the COVID virus further deteriorates or damages his lung, then the chances are of his survival becomes less, because already the lungs are damaged and the COVID is further destroying the lung. So these patients are at risk for more complications.
Uh, Next question is, yeah, who all can be the part of cancer care team for a patient in terms of doctors?
In terms of doctors, the
Ha,
primary physician, the oncologist, and then the medical oncologist, radiation oncologist, surgical oncologist, nursing staff, counselor, the then the ward boys, then the junior doctors, RMOs, casualty medical officers, all these, and most important, the caregivers, the family members, all these forms a team for giving care to the cancer patients.
Next question is, does the treatment of cancer affects a person day-to-day life? Will he be able to work or exercise or do his normal routine?
Majority of the patients, yes, are able to carry on their normal lives. In if the patient has been diagnosed in early stages and he is fit, then they are absolutely fine to do normal activities. We have many of our female patients who are lecturers and they have breast cancer. They come in the morning at around 8 a.m. By 12 they finish their chemotherapy, and then they take the lecture at 2 p.m. and go back home at around 4 p.m. or 5 p.m. So they can easily carry out those activities. Or we have bankers who come in 7 a.m. in the morning, they finish their chemotherapies by 10 and then go back to the bank and do their jobs. So it depends how the patient is tolerating, how the fitness is of the patient. We have no issues if the patient goes back and work.
Thank you, sir. One more question. Is it a compulsion to undergo all the three treatment, that is chemotherapy, radiation, and surgery?
No, it depends on what type of cancer you have, what stage of cancer you have. So suppose breast cancer, if it is early stage, the surgery is just enough. You may not require a chemotherapy, or you may not require a surge or radiation. Now, if suppose if there is a gallbladder cancer in a very early stage, just surgery is good enough. You need not require any chemotherapy or radiation therapy. Similarly, in blood cancer, you need not require any surgery or radiation. Just a tablet would help to take care of the patient. So it depends what kind of cancer is there and what stage it is in.
Mr. Alok Ranjan is asking, what are the survival chances in leukemia if it is detected early?
So we have four types of leukemias: AML, ALL, CML, and CLL. So CML and CLL are chronic leukemias, and if detected earlier, then the patient keeps living for 15 years, 20 years, 30 years down the line. AML and ALL, the earlier we are able to detect, the better are the chances that we will be able to cure the patient. So 5-year survival for early detection of leukemias, acute leukemias, is about 50%, whereas for chronic leukemias is about 90%.
Next question is, sir, what is your role on immunotherapy drugs in future and current also?
So immunotherapy are a newer paradigm in which we have drugs which boost the immunity of the body in the cancer patients, and with which the body is able to identify the cancer cells themselves and kill those cancer cells. It is like giving a booster injection to boost the immunity. So body becomes strong and is able to kill the cancer cells themselves. They have very minimal side effects and very good role, especially in lung cancer, in bladder cancer, in melanomas. We have seen patients surviving for long years. I have one patient who is still living since last 5 years on immunotherapy and is doing very well.
Rightly said. Two more questions we have. One question is from Mr. Rajshekhar. What is the future of chemo drugs considering MAPS?
So monoclonal antibodies have definitely improved the survival of the patients, but chemotherapy remains the backbone. So what I usually tell the patient, that chemotherapy is giving you 70% benefit. Monoclonal antibodies, when added, gives you about 10-15% extra benefit. So suppose in lymphoma, B-cell lymphoma, CHOP is a chemotherapy which has a major role. But if you add rituximab, the survival, the response rate increases by 10 to 15%. So the chemo and monoclonal antibodies will always remain hand in hand.
One last question, and I think this is for patient uh, related to COVID. Since there is fear in mind of people regarding vaccination, especially in cancer patients or patients who are taking immunosuppressive drugs, should they go for vaccinations, or is there any serious side effect related to it?
No, they should definitely undergo vaccination unless until you are undergoing a bone marrow transplant. All patients are eligible for taking vaccines. There is no harm in taking vaccines. I tell these to my patients regularly: please go and take vaccine, prevent yourself from COVID, so that you are at least safe from that point of view. So you should definitely take vaccine.
Thank you, Mittal sir, for taking all the questions and clearing the doubts of our viewers.
Thank
It
you
was
so much.
wonderful having you here. Any concluding remarks, sir, from your side?
So I would again insist that prevention is the best cure. Any lump in the breast, painless lump, please tell your mothers, sisters, friends that they should go and talk to the doctor, because I've seen breast cancer is one of the cancer which is preventable. Patients do not tell that they had lump. So please, and for the males also, get your executive health checkups once a year so that you can at least find out if there's anything abnormal growing in the body. Thank you so much.
Once again, thank you. Thank you, Mittal sir, for sharing your valuable time and knowledge with us. It was indeed a pleasure having you here today, and we hope that in future also we can meet on such important topics.
Thank
Also,
you so
thanks.
much.
Also, thanks to all the viewers who have joined us. Till the next time we meet, on behalf of entire team of RPG Life Sciences, stay safe, take care, and goodbye. Thank you.